this new view suggests a whole different way of approaching it.
Harm reduction, is that what you're referring to? Reducing the harm to the person, to society, rather than trying to win this game.
Trying to either legislate abstinence
Yeah.
or coerce abstinence.
Mm-hmm.
None of us like to be coerced
No.
into changing, and what we often find when we
Some
feel
people just
coerced
love
is we
to
kick
coerce.
back.
Yeah. Some people like to coerce. They look for the kickback because they want to come even harder and force the issue.
So what we're involved more often than not in is a kind of power game, or a power struggle, and the power struggle just leads to further struggle.
Right. You've seen that. I think anybody who's been in any sort of rehab or situation where they were forced to sit around in a circle, to get off a ticket or something like that,
Forced.
has been in that situation,
the key
right?
is forced.
Yeah.
So what this new model suggests is that a treatment approach that is going to individualize and attempt to understand the particular currents that give rise to that behavior for this individual.
Yeah.
And are going to attempt to meet that person where they are in a very kind of collaborative, relationship to determine together, what goals and what approach make the most sense for that given individual. So harm reduction would then embrace any positive change, any reduction in drug-related harm, actually including abstinence.
Sure.
So it's not an anti-abstinence approach.
If that works for certain personalities, that's fine.
Absolutely.
Right. That worked for me for cigarettes. I mean, I smoked tobacco, I smoked cigarettes. I had to put it out and make it as a challenge. It's me or the cigarette. That worked for me, but I wouldn't expect it to work for other people because not as many people are as bullheaded as me. So they would need another way of doing it, maybe patches all over their bodies, some other way to do it more easily. Some people don't mind going to the dentist, and other people need to spend extra money to go to one that puts you to sleep, even for the simplest thing, and it's very
Okay, so now you're getting at another issue, which is that, we human beings, including all of us who have had some kind of addictive issue at one point in our lives, are a broad, diverse, group of humans.
Absolutely.
And why should one-size-fits-all treatment be appropriate for this, broad, diverse group of people? So there are lots of different routes to positive change. And what the harm reduction psychotherapy approach attempts to do is to create a space in a relationship where we can collaborate to figure out what are the particular issues that are operating in your addictive behavior, what goals and approach is going to be best suited to you. So it might be you quit cold turkey, somebody else needs the patch, somebody else needs the patch plus medication, somebody else needs a support group.
Right. Somebody to call at 3 in the morning,
Yeah, and it's the same with all drugs, including alcohol and
all the other
addictive
addictions.
behaviors.
Before the show, we were discussing some other addictions, interesting addictions, shopping, sex, other addictions as well, I'm sure. Eating disorders or like that, and they seem to be. So is this, not to go, to me this is worth just... Is addiction, you get the idea that evolution is supposed to bring things to the fore that help the human being survive, right? It had helped us evolve and survive better, each generation better than the generations before. Where would evolution select for addiction? What is the positive side of addiction? Why would you want to get somebody addicted to something?
Well, that's a fascinating question.
Why would the body react as that way and not in a more protective way since it's so destructive?
Well, one of the things about addictive behavior is that the addictive object or the addictive activity works. It actually, in the short term, helps people to feel better.
Right. So drugs aren't entirely evil. They do, to a point, work.
Well, they work in some sense.
Yeah.
And it might be pure positive pleasure. I mean, let's face it, alcohol and drugs haven't been on the planet since virtually the dawn of civilization and used by humans.
I'm sure.
because they don't work in some way.
They do.
So
I've heard it said morphine, poppies, opium is the only drug that every doctor who's ever lived can even agree works. Yeah. As strange as that seems.
yeah. So the addictive activity has a payoff. Mm-hmm. It provides some pleasure, or it provides relief from pain, mm-hmm. or it provides some kind of shift mm-hmm. from some kind of distress. Sure. So it's a short-term solution. Now, those short-term solutions, I think, can backfire if people become overly reliant on them. Okay. And I would say that the short-term solution, the short-term kick, may be part of the biological aspect of what contributes to addictive vulnerability. Mm-hmm. But let's add in the psychological dimension. If somebody has a history of trauma, if somebody is seriously struggling with stress or anxiety sure. or depression or complex stressful life conditions, poverty, homelessness, being the member sure. of a stigmatized social group, all of these factors are going to add to that biological kick and actually contribute to it feeling even more important, or in some cases, vital.
Mm-hmm. To the person's life that they do this.
Vital to survival. And
it seems that way we've played some of the documentaries on this show that people have made of people with serious addictions who have allowed themselves to be filmed as part of their treatment, trying to get treatment, trying to prevent another member of their family from dying, basically. And so we've seen it graphically.
I think the mistake is to consider that what makes it feel vital is all about the drug or your biology. Mm-hmm. Because if you sidestep these complex emotional and contextual, social factors, it's like you sidestep what really needs to be addressed. If I'm suicidally depressed, for example, because I've been raped or I've had a history of trauma as a child, and now I live with tremendous difficulties in connecting with people, and I lose a job and now I feel hopeless and think about dying. If a drug actually helps me get up in the morning and get out to look for a job, I may feel that I need the drug to survive emotionally.
Right.
And that can contribute to that sense of reliance and dependence.
Right. I'm sure a lot of people can say they felt that if they haven't totally reacted the same way as some people have. They've felt that feeling, right? And some people find a way, French fries sometimes do it for me,
Well, then let's add in another dimension, which is the dimension of habit.
Right.
So we've got meanings, we've got reasons why people use these things. But over time, if you find a solution that actually works to help you with a negative emotion,
sure.
and you repeat that sequence time and time again, it's kind of like training a dog.
Okay.
You train yourself
right.
to crave that activity.
I've seen people do that with sugar. Andrew Tatarsky is a drug treatment professional, 30 years in the business. He's an advocate of harm reduction, which we've been discussing here. I want to ask you about your speech in Ireland and about the treatment that you're doing right now. But I have one question to segue into that, and let's talk about Ireland first. After that is the question that's come up so many this year. We've had several very famous, beloved figures, Amy Winehouse and others who have died of drug overdoses, and that has made people think, going back, to Janis Joplin and going back even before that to the 50s, Ladies Sing the Blues. I mean, what is it about people in the spotlight that we see? Is it just because it seems that way? It's no more than the average population, but is there a susceptibility when you're in the spotlight, famous like that, to dying from drug overdose?
Well, now what you're speaking about is some of the complexity that contributes to vulnerability to using drugs.
Yeah.
Famous. First of all, the trajectory of a artist's career as it begins to take off is fraught with so many threats, conflicts. you know, I'm only as good as my last album. You know, am I going to, cut another album and it's going to bomb and I'm going to be humiliated on the world stage? This can be such a tremendous support, source of anxiety. And then as I get older, like Whitney Houston, am I still going to be beloved? You know, we know that the careers of beautiful women are limited. In the, so this is another
misogyny of our society.
By the misogyny of our society.
Right. So interesting. So these are the type of pressures that, when you're on the spotlight, they're magnified. It's like a laser beam of pressure that's on you all of a sudden.
Right, and also people who are drawn to celebrity or drawn to art are propelled there for complex psychological and emotional reasons. You know, the wish to be loved, the wish to be admired.
The type of addiction we're talking about, pills, all right, prescription drugs. To me, that's interesting. Recently, we're not seeing people dying from heroin overdoses. It's not like John Belushi 30 years ago. We're finding people are dying from things that they got legitimately.
Actually, you may know that the #1 source of drug overdose right now is prescription drugs.
Yes.
So, I mean, what this also speaks to is that we are living in a culture that is a quick fix culture, that is looking to medication. We have
which makes the whole making it illegal so strange, and it's right.
We have a pharmacological industry that is invested in the promotion of drugs as
Andrew Tatarsky, this is fascinating. I want to give you an opportunity, though, to our viewers to tell them how they can learn more about you and get more information about what you're doing.
Well, you can go to my website, www.andrewtatarsky.com. And on my website, I've got a number of papers that I've written that describe the integrative harm reduction psychotherapy approach. I've written a book, Harm Reduction Psychotherapy, A New Treatment for Drug and Alcohol Problems, which you can read reviews of and excerpts from up on the website. And I also have information up there about my new Center for Optimal Living, which is a psychotherapy and training center here in New York City that is showcasing this approach. It's the only one in New York that is putting harm reduction work front and center.
Interesting. Now let's talk about your. You were speaking in Ireland about that addiction. Well, the addiction is not just in the brain. It's not just a medical problem. Because most people, it says the knee-jerk reaction is, addiction. That's, even the positive, more progressive people are the ones who are going to say, it's a medical problem. It's not a problem of your yourself, of your spiritualness or your wholeness or anything. It's a medical problem. But you're saying it's not really just a medical problem.
Yeah, the title of the talk, it was a plenary talk at the National Drugs Conference of Ireland back in November.
Sure.
So I had this wonderful opportunity, invited to speak to drug treatment professionals from all over Ireland who came together. And I thought, what are some of the most important ideas to get across to the group? And it seemed to me the idea that addiction is not just a brain disease. It also relates to the multiple meanings of drug use that we've been talking about, and the critical need for psychotherapy. If we think about chronic drug use as on a continuum of severity, over time, with some people, there are brain changes, and those brain changes contribute to the desire to use drugs. That's what we're calling the brain disease aspect of addiction. And we could say that the higher doses people use and the longer they use, the more likely there is to be brain involvement. But it's not just about the brain because of these multiple meanings that get wrapped around and the habit aspect that we were talking about. And so that was the point that I was trying to get across.
So the personality, so it's coming full circle because you're saying the personality does have something to do with it.
Absolutely.
Right.
Now, in my research for that talk, I was looking at the research on trauma.
Okay.
And there are some very, very interesting findings that support what I'm talking about.
Mm-hmm.
There was a study that was done of people with serious drug and alcohol addictions,
Mm-hmm.
and they looked at the early experiences
Yeah.
of these people in childhood,
Mm-hmm.
and they identified about 8 difficult early experiences,
Okay, that's
including sexual abuse, physical abuse, the traumatic loss of a parent,
Interesting.
divorce, a number of other ones. And what they found is that the more of these difficult earlier experiences that occurred in people's lives, the higher the likelihood of addiction.
Okay.
So what they concluded is that addiction is related to early difficult childhood experiences. And what we're learning now is that early trauma of these sorts actually does contribute to difficulties in feeling states, in the ability to manage one's feelings and manage one's self-esteem, feelings of mistrust in the world.
It's taken
And
society.
those factors actually contribute to vulnerability to using drugs and alcohol.
What? How can people? Do you have a website or something like that that people can? You want to tell folks your website?
Again, the website is www.andrewtatarsky.com.
Spell that for people.
That's ANDREWTATARSKY.
Great. And they could also look you up under harm reduction. The name of your institute again is?
Yeah, it's the Center for Optimal Living. I should mention that I was lucky enough to have that talk that I just talked about videotaped.
Oh.
So I have a video of the talk up on the website.
Oh,
that
great.
people
At
can.
andrewtatarsky.com, so you can see the video of what we're talking about. Excellent.
Yeah.
Oh, we've got 2.5 minutes. Anything you want to sum up about what we've been talking about? I know that people in New York live under a special amount of stress. But it's not the only places where drugs are happening. I mean, where people are using drugs to try and survive.
What I want to say about harm reduction is that it's really a philosophy for living.
Yeah.
You know, we accept that risk is part of life. And living in New York is filled with risk.
Sure.
I mean, there are occupational hazards associated with being a musician, being on Wall Street, being, an
Occupy Wall Street protester.
An Occupy Wall Street protester. So a philosophy that accepts that risk is part of life, and rather than just holding the absolute of stopping or reducing all risk as the ideal, let's be realistic and accept that we actually can continue to engage in risky behaviors and take all sorts of measures to reduce the risk, as we do when we drive a car. We use a seatbelt.
Yes.
When we ski, we hopefully take lessons and we know what we're doing and we
keep
wear
off
helmets.
The diamond,
so that people who are drinking heavily and using cocaine and whatever is part of the scene here in New York can look at their use patterns, begin to make healthier choices around reducing the amount they're drinking, around not driving when they're drinking, around having buddies with them who are kind of looking out for one another when they're using. So there are all sorts of very practical things that people can do that help.
Okay. And do you think that we have half a minute? Are they going to legalize drugs in America ever? Is it possible?
I believe that they will. And I don't know if you know, but Vice President Biden right now is in South America meeting with former presidents and current presidents of many South American countries who are increasingly advocating for legalization. So the movement is coming internationally to put pressure on the United States, and I think that change will come.
Thank you, Andrew Tatarsky. See you next week. You did it. Did it? Yeah, okay.